Patty Stalker here from WestfordCAT, and I'm with Jeff Stevens, who is the health director for the town of Westford. And we chat every week or so to sort of give an update on what's going on at the health department. Particularly, we've been talking about COVID-19 over the last year, obviously, for obvious reasons. And I thought that we could catch up a little bit, Jeff. Starting March 22nd, two things happened. Massachusetts went into phase 4 of reopening. And
Yes.
and also another group of people are eligible for the vaccine now. That would be 60-year-olds and older, and then a group of particular workers in the state of Massachusetts. And also, I wanted to chat with you a little bit about vaccine supplies. So why don't we start with phase 4 reopening, and what does that mean for the town of Westford?
So the phase 4 reopening really means this. Gathering sizes have now changed, and they have now gone to 100 people for an outdoor gathering. 100 people for an indoor gathering, 150 people for an outdoor gathering. Dance floors are now allowed at certain events, such as weddings, and there are guidance documents for how you need to act and behave at those weddings, such as if you're dancing, you do need to wear a mask, things like that. I think they may give a dispensation to a bride and groom if they're doing their dance, but we'll see how that goes. Additionally, some food workers are now able to get vaccinated, and some other specialty groups that are allowed to be vaccinated because they're considered essential employees. So they're now in that chain of vaccine. And additionally, stadiums, arenas, and ballparks are allowed to have, I believe it's 12.5% capacity. So there are people that will be able to go to opening day for the Red Sox now, which I know is going to make a lot of people happy. So there are some definite positive changes forward in heading back to what the governor called our new normal. But within that, I can tell locally, concerned about a certain few things. We are seeing a slight uptick in our COVID numbers once again.
Mhm.
And when I say slight, it is slight. We're seeing 3 to 4 to 5 more cases a week than we were just a few weeks ago. And that trend hasn't stopped going up yet. What I'm hoping for is that trend will plateau and hit its peak far sooner than we did in the months of January and early February. That's when we saw our biggest numbers, and we were working with contact tracers, sometimes up to 18 hours a day, 7 days a week, keeping in front of that, trying to make sure people understood that they were being notified. We don't want to be back there. So what I think is really important, as great as it is that we are overall in the state seeing lower numbers and they are not climbing as fast locally, that's not the case.
Mhm.
We are seeing a slight uptick, which means people still need to pay attention to what they're doing and sticking to the big 3 of washing your hands, socially distancing, and wearing your masks. We know they work and still very much needed. Some other data I can give within that is in looking at the 7-day 7-day data from last week. We're seeing several families that all are becoming infected. So I know there's at least 2 or 3 families that have families of 4 that now are all COVID positive. The good news is many people seem to not actually be becoming very sick, but statewide, we still know people are getting intubated. We still know people are getting hospitalized or getting treatments. So we can't just say we're out of the woods quite yet. We got to just keep working a little bit longer and keep doing the right things.
When you said indoor gatherings top at 100, what kind of gathering would that be? I mean, I'm not assuming a house party, or is it?
No, a house party, you can only have 10 people at your house.
That's
10
what I thought. Good.
And you can also have 25 people outside. And again, everybody needs to be wearing a mask. So that has not changed for the residential setting. The gathering might be if somebody's renting a tent at a facility and they're going to have all four walls up, which would make it a indoor space at that point.
Mhm.
They would then be able to have 100 people socially distanced on the inside.
And would that be like a wedding reception as well? 100
Yes.
would be the cap? Okay.
So you would be capped at 100 for a wedding. If you did the wedding outside, you would be able to have 150 at an event facility.
Do you, and this is complete speculation on your part, or maybe you've heard something. If we do see the numbers start rising, again in Massachusetts at a high clip, do you think we would go back to phase 3, step 2, or are there any? Has there been any talk of that?
So if the numbers do go up and they go up sharply, the governor has demonstrated several times that he would
Mhm.
certainly roll back the phases, which has happened.
Mhm.
So I think if we see a sharp enough increase, we certainly would see phases roll back. And what I'm hoping, as I'm sure many other public health people are hoping, is that race between infection and vaccination is won by the people getting vaccinated. We're seeing anywheres to 50,000 or more people a day being vaccinated based off of what the state numbers are of total vaccinated people each week. That's a pretty good amount of people. And we're not seeing that same rate of people getting infected right now, which is really good. If we saw 50,000 people being infected each week, I think we'd see lockdowns happening very, very quickly. And that's not the case.
From what I'm understanding from people that are trying to get the vaccine, it is taking some time. You can pre-register or register, but you almost, if you're waiting for a mass site, you're going to get contacted. But the other places, from what I understand, you just have to keep going on the mass.gov website and sort of, a couple times a day and hope to find an opening that you can register for, because most places are out of the vaccine, from what I understand.
There's no doubt that there are more people that want vaccine than there are vaccines available right now. That's been the case since day one. And until more vaccines come online in larger quantities, that's going to be the case. Every week, the state will get a certain allotment. That many more appointments will be placed into the state mass vac sites. And additionally, the places such as the CVSs and the pharmacies that also are able to vaccinate will get their allotment, and they will be able to open up appointments as that goes as well. My advice to anybody who is looking to get vaccinated at this point is to look on any of the local sites, such as your CVS or Walgreens or pharmacy websites, and continue to work at looking at the state mass vac sites on when appointments open up. I hear people all the time that are getting appointments, so I know what's happening,
Mhm.
but it may be frustrating if you get on and you're finding out that you're not able to do it this week. But each week, more people are getting done, and there's going to be more opportunity to be able to get yours is done as well. So I just urge people to stick with it, be vigilant, and everybody's time will eventually come.
Do you see the federal government getting more vaccines out per week or per day?
So we're very hopeful that they will, and we are all still very hopeful that local communities such as Westford will get an allotment of vaccine where we'll be able to vaccinate groups of people. To date, that has not happened. We have asked every single week for a minimum of 1,000 vaccines, and we are hoping that we'll be able to get some at some point. And once we do, we will open up clinics and be able to start vaccinating people here.
Well, I've seen in the Board of Health meetings, yeah, you guys definitely talk about it, and you're a tenacious group. So thank you for sticking with it and getting hopefully getting those vaccines here locally in Westford really soon. So I think the bottom line, if we want to continue phase 4, which is the new norm, again, don't let your guard down, social distance, wear your mask, wash your hands, and follow the guidelines that the state has put forth so we don't have to roll back. I just would love it if we could get vaccinated and everybody just keep doing what they're supposed to be doing. And maybe we can actually have an enjoyable summer this year.
That's what we're hoping for. That's what we all want. And if we just keep towing the line a little bit longer, I mean, we're still in the tunnel. We can see the light at the end. We just need to get to the point where the tunnel's behind us.
Great advice, Jeff. Anything else you'd like viewers to know, Westford residents to know?
I know people are getting tired. I know people are tired of having the fight, but if you don't feel well, stay home, get tested, and find out.
Great.
You
Yep.
can still carry the virus even if you've been vaccinated. So just be aware of that. It doesn't mean that you're going to get it, but you can still potentially carry it and infect people that have not been vaccinated at this point yet. So until we achieve that that term herd immunity,
Mhm.
I think we still are going to have to continue to fight this fight. And I'm not sure what our new normal as a country will look like yet when this is all said and done. That's still developing, but we'll get there. And with any luck, we can get this mostly behind us, or at the very least in very much control.
I hope so. And again, like I said, I would love to have an enjoyable summer. And we just got to keep at it. I completely agree with you, Jeff. So thanks a lot for your time. I know you guys are busy over there, and we'll touch base again in a week or two and just sort of keep, you can keep us updated on what's happening with the vaccines and the numbers in Westford.
Sounds good, Patty. Thank you.
Thank you. For WestfordCAT, I'm Patty Stalker.